Welcome back, everyone, to our virtual coverage of ACC 2020. I'm Kevin Kunzman, Managing Editor of HCP Live, with yet another House Call Special Edition video conference interview with a member of Atrium Health Sanger Heart and Vascular Institute. Right now, I'm talking to Dr. Dermot Phelan, who's the Director of Sports Cardiology at Atrium Health. And Dr. Phelan has a lot of perspective to share today on exactly what the role of sports cardiology looks like in relation to a major medical meeting like ACC's agenda, especially with it going virtual. There's been some reprioritization and a reestablishment of exactly how discussions are going to feed into each other. But as Dr. Phelan can emphasize, this is still a very important topic for especially our younger athletes who may be at risk of concerning conditions. So Dr. Phelan, welcome to the chat, and thank you so much for joining us.
Thanks so much, Kevin. Yeah, no, delighted to be here at a very unusual point in time with COVID-19 currently taking place and unfolding in front of our very eyes.
Yeah, I really wish we were safe and sound preparing to go to Chicago and we could do this in person, but nonetheless, I'm glad we can make this connection either way. I think it's a worthwhile conversation regardless of the medium. So first and foremost, let's talk about hypertrophic cardiomyopathy. I know that there is some discussion planned for late breaker data coming out of ACC this year related to the disease. Can you highlight a little bit of where research stands for this condition, what its, I guess, strain and stress is on U.S. health right now?
Yeah, it's a very important question. So hypertrophic cardiomyopathy is actually the most common genetic cardiac abnormality. It occurs about 1 in 500 people. And I always emphasize to my patients that for most people, they have a normal life expectancy. And they don't run into any major complications, but for a sizable minority, they run into very severe complications. The most feared of these is sudden cardiac death. And so when we think about young athletes on the field who die suddenly, at least in America, the most common diagnosis is hypertrophic cardiomyopathy. Now, one of the things that they run into is because that muscle gets very thickened, they can get obstruction to blood flow. And the traditional way to deal with this is with medications, but these are often not very effective. And so if the medications don't work, then we need to do surgery on them. So one of the big trials that I'm most interested in at this ACC is going to be the Maverick Trial, which looks at a new drug called mavacamten. It's a phase 2 trial. And so there's been a lot of promising data there looking at this drug in terms of reducing outflow tract obstruction. And so we may be able to avoid the need for open heart surgery in a lot of these patients if they respond to this.
In relation to, my extent of knowledge into the disease and the event and the risk of it in relation to growing up playing sports was, one, unfortunately losing a former teammate, of course, to the condition, but two, also understanding that the response has largely been resolution and regulation of practice times. The amount of extent that was put onto us in certain sports. I played football, and 2-a-days meant something completely different from year over year because of these things that were happening to kids very unexpectedly, out of control. That's sort of the layman's response to it, and I think that's kind of what's headlined it, unfortunately. It seems like we need to we could stand at least to embrace a greater role of sports cardiology in our research discussion at meetings like ACC, right?
Yeah, I couldn't agree more with you, Kevin. I think this is a real challenge. And in fact, the ACC and the European Society of Cardiology both have recognized that we need more data in terms of how to evaluate and how to manage young athletes for potential heart disease or athletes who have heart disease. And so they both have recognized sports and exercise cardiology as a separate subspecialty within cardiology. There's many ways to try and deal with this. Unfortunately, we all have either personally experienced or know someone who has died suddenly. Even though this is a rare event for athletes, we need to do a better job at trying to identify those people who are at increased risk. But also then for those people who have heart disease to be able to give them better guidance on what is safe and what is not safe in terms of exercise. And then finally, I think the most important thing is that we really emphasize the importance of first responders and that we have appropriate emergency action plans for all sporting events, so that, you know, if something were to happen, that people have the knowledge in dealing with these people and are able to do hands-only CPR, are able to have an AED available and are able to apply it within 3 minutes. And so I think educating the general population, educating our school children who are playing the sports, and educating everyone is important from this perspective. I think that's part of the mandate as well for ACC Sports and Exercise, that we need to bring forward that education and help people respond appropriately.
Could we talk a little bit about how you believe that should be made up in relation to a meeting's agenda such as ACC? How would you, if you had you know, some more control in exactly how that would be represented, what would it look like for you?
Well, actually, so I'm part of the ACC planning committee for the ACC Care of the Athletic Heart. So this is an independent meeting that will be run in June. Yet to be determined if this will have to be a virtual meeting or whether it will be in person. Right now it's still scheduled to be in person. And so I'm also part of the ACC Leadership Council for Sports and Exercise. So this is a question that we have to address, and we will be, in terms of how do we structure these kind of events. And so I think the big question right now is that most cardiologists in their day-to-day practice deal with patients who are not young athletes, right? They're dealing with more elderly people who have lots of comorbidities. And then in the middle of their outpatient department, they're getting some young patient coming in who is an athlete that has concerns. And so they're not used to dealing with this. And I think a large part of it is to educate the general cardiologist out there about the major issues that young athletes have, but also to highlight to them that there are experts around the country that deal with these kind of questions on a day-to-day basis. So for the Care of the Athletic Heart meeting, for example, what we're really focused on is doing a lot of case presentations. We put up common situations that young athletes present with, and have experts give their take on how to evaluate them and how to treat them. You know, athletes have very unique findings. So as you exercise, you develop changes both on your electrical tracings, your ECG, and on the morphological assessments, so on echo and MRI. And so a large part of our research and training is to try and define what is normal for various different athletes, different ages, and then disseminate that information so that people are not either ignoring things that are a concern or over-testing for things that are actually normal for that particular athlete.